What indicates infectivity? It is envelope antigen positivity means high infectivity. Rheumatoid factors IgM against G, men against girls. Then radio opaque stone, where do you see calcium? Acute small bowel obstruction adhesions post-operatively is the most common underlying cause, is what you need to basically understand. Please call our Gandhi Secunderabad students and tell whether he refreshed the browser or not. Yeah. Yes. Now the fructose in seminal fluid, how is it basically obtained? It is from the seminal vesicle. CA99 is the tumor marker of the carcinoma pancreas. What is the gastrinoma triangle? So you have cystic duct, common bile duct, and the junction of the neck and body of the pancreas. You know very well. Colorectal carcinoma most commonly is seen in the case of the rectosigmoid, is what you have to basically remember. Now, how to diagnose the early gastric cancer? It is the depth of the tumor invasion. So, the Japanese gastric center, highest amount of gastric cancers all found in wherever people eat smoked foods like China, Japan, etc. 24-year-old with a poor socioeconomic status with high-grade fever, he was dehydrated, and there is a abdominal examination showing distension and tenderness. Then what is the most likely underlying possibility for his condition? So it's a case of typhoid ileal perforation is what you have to basically remember. The abdominal distension and right lower quadrant abdominal pain is an important clue for you to make the diagnosis. A woman is involved in road traffic accident, and on inspiration her chest wall is getting sucked inside. That's called paradoxical breathing. During inspiration our intercostal space must blow out, but it is sucked in, means it is a classical case of flail chest. When will it occur? Whenever the rib is fractured at two locations, then typically during the inspiration the intercostal space becomes sucked in due to the negative interthoracic pressure, is what you have to remember. Commonest cancer globally is the bronchogenic carcinoma, which you need to remember. Acute ischemic ulcer in the leg in a young male smoker, classical of Buerger's syndrome. After eating a very large Sunday lunch with alcohol, the patient is being brought. He has got a severe chest pain, and there is a shadowing in the left lower zone, so which is very classical of esophageal rupture. Then esophageal diverticle, actually this question there is all the four statements are true statements. So you need, this question stands a bit of correction. Sigma students have you called? They are logged in back. The peptic ulcer in the posterior wall in the first part of the duodenum, it can bleed. The source is the gastroduodenal artery, which is a branch of the common hepatic artery, is what you need to remember. Now, for the gastroesophageal reflux, how do they present? Whenever reflux is there, that leads to nocturnal cough. That's the reason don't say every cough is a pure cough. Especially night time, too much cough is there, dry cough is there, which is irritative cough is there, then you should think of the possibility of the gastroesophageal reflux. 56-year-old who is a chronic alcohol consumer in shock. He has got a bleeding varices. After initial resuscitation, the best treatment is to do endoscopic ligation, which is considered to be the management of choice. In ischemic colitis, what is the most common area, which is the watershed zone? Splenic flexure is the one which is most commonly involved, is what need to be remembered. Then Renal tubular acidosis is a normal anion gap acidosis, which is a state of hyperchloremic metabolic acidosis is what you need to ultimately remember. Then what is the advantage of a PGE2 gel versus vaginal tablet to induce the labor? If there is any hyperstimulation, then you can always remove if it is a tablet, right? Simple. Then what is included in the biophysical profile? Amniotic fluid volume, fetal movement, fetal tone, fetal breathing, fetal heart rate, they are the ones which comes under the BPP, which has got the 5 components. Whenever you are dealing with molar pregnancy, then what is the importance of pre-treatment beta HCG value? Actually this question, all the 4 are wrong responses, so right responses. It can be used for risk categorization, baseline for follow-up, planning, management, staging, everything is true. So one more error short. So what are the most common sonographic measurement to assess the gestational age? It is the CRL, which is most consistent and reliable marker. You want to do a destructive procedure like a craniotomy during pregnancy for a dead baby which has got a hand prolapse. What is an important contraindication for this? Typically, if the patient is having a bandle string. So, to do craniotomy, what are the indications? First, the baby should be dead. That does not mean you kill and do. Then the head must be impacted. The cervix must be at least 7 centimeters dilated. And her uterus must be unruptured or not in the imminent danger of rupturing. If the bandle string already is there, means it's so thinned out and ready to rupture anytime, right? So you will kill both baby, already baby killed. In the process of destroying him, you are destroying mother, not correct. 35-year-old is found to have moderate dysplasia on the pap smear. So the next step is to do a colposcopy. So all that protocol, what do you want to do if it is a endocervical lesion, if it is a squamous cell high grade lesion, what do you want to do, low grade lesion, what you want to do, all those Betitsa protocol is there, no? Pakka rehna. 30 out of 30 mark ke aana, gynops mein. Very easily achievable, 30 out of 30, right? So, because there is no surprise about gynecology obstetrics. Fallopian tube is fallopian only, right? Mullerian development, if it decides upper part or lower part, it won't change over a period of time. The vaginal development, which part is urogenital sinus, which part is from Mullerian system. So all these things, they don't change much. So that's the reason they are all the standard list of facts. So what is the very common non-obstetrical surgical emergency? Most common acute appendicitis. 60-year-old has got a adenocarcinoma endometrium and negative notes are there according to FIGO 2009. Endometrial, cervical, vulvar, vaginal, ovarian, tumor classification of these 5 panchabhutas. If you do mistake, doctor, andar bhi nahi aane dete. Gynecology obstetrics ward mein. So you have to be sure, gritty and go to the exam with confidence. And you ask your friends to study useless things like kidney classification padho tum, bladder classification padho, prostate cancer classification padho. Oh, they will never ask those questions at all. So you should know where to not waste time, right? If you are working very hard means, oh, this fellow is working very hard, almost all 14 hours he is sitting in the reading room, even not getting up for washroom also. We used to maintain a small diary. How many people get up, how frequently for going for washroom? instead of studying in the reading room, these things, extracurricular activities used to be high. So some used to sit like a catatonic epilepsy, catatonic schizophrenics, hiltane, and few people restless leg syndrome. Tuck, 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 tuck. Oh, I'm feeling very, very, very heavy. Yaar, bahut tension aa rahe. Then bahar jao, andar rao, bahar jao, andar rao. You will be so irritated that that kirr sound of the table, they will make a movement and then keep walking out. But reading room is a good mental asylum, right? घर में बैठे तो ज्यादा टेंशन आता. Reading room गए तो we'll have co-psychotics, co-maniacs, co-obsessive neurosis also. Underline, underline, underline. ऊपर से underline, second time underline, close the book. Anxiety. Once more underline, underline. So second reading, third reading, fourth reading, 10th reading, 20th reading. अरे Asian paint डब्बा लाके उसमें डाल दो. That is much easier. So that's all the fun. Tomorrow, another 4 or 5 months, you will become postgraduates. All this become a history, and throughout life, when you remember the wonderful days of the reading room, these wonderful days don't come back after you get seat. Take it as my word, right? So enjoy it. Those tables which are inevitable, बट्टी मारने में आप number 1 निकलना है, right? But those which require conceptual clarity, batti mat maro. So, what is the most common type of HPV, doctor? Once more, batti wala question. HPV 16, sweet 16 is most carcinogenic. Then cul-de-sac mein, you don't have lymph node. You can have blood, you can have a ectopic ovarian tissue, or you can have bowel, etc., etc. Right? You can image all those things, not lymph nodes. So folinic acid is for the methotrexate rescue, and the yolk sac is visualized when the gestational sac size reaches around 10 mm is what you need to basically remember. And in ovarian malignancy, what are the ultrasound features that suggest that there is a malignancy? Thick septae, low resistance flow, papillary projections. They are all the things which are highly suggestive of malignancy, not locularity. Now, the histological appearance of a ovarian tumor has been given to you. So, looking at it, you must make a diagnosis what it is. So, it is a mature cystic teratoma, which is the most common ovarian neoplasm in the patients younger than 20, and it can lead to hyperthyroidism, hence TSH fall down. Most lesions are unilocular, and the resection is advised if it is more than 7 centimeters. Now, NST, non-stress test, when it will become reactive? Typically, it will become reactive by the time 32 weeks of gestational age come. Then 31-year-old in active labor, fetal heart rate is showing variability, and what should be the management include? So, bulb suction and tactile stimulation of the perineum. So, you must be quite sure on the fetal well-being and what is the role of amniotomy, indications of amniotomy, etc., etc. So, I leave the literature for you. Now, a patient delivers a live-born male. Apgar score is being given, and she denies any rigorous chills. So what is the proper management in this given case? Ampicillin, gentamicin, clindamycin are the ones which has to be initiated as whenever there is any development of endometritis as a complication. Then the last but not the least for today is 30-year-old has come for the routine obstetric care. So, what is a measure that can be used to reduce her incidence of another preterm delivery in view of her earlier history of preterm? So, it is the progesterone suppositories which will bring and relax the smooth muscle, which can be used in order to delay the preterm is what need to be understood. So, that is all the story, doctor.